Welcome to another episode of Coffee with Carriers. I'm Tim Falanga, Senior Vice President for Amwins Connect here on the East Coast. Welcome everybody. Today I'd like to introduce our friends Rob Tees and Jeannie Sutton from Anthem Blue Cross and Blue Shield of Georgia. Guys, welcome. Tell us a little bit about yourselves.
Well, my name is Jeannie Sutton, as you said, and I am the Director of Individual and Small Group Business for the state of Georgia. I manage 10 people, 3 sales reps, 7 account managers that work the entire state, and we're just happy to be here.
No easy task, an entire state.
Yeah.
Welcome.
Thank you.
Tim, thank you. It's great to be here. We appreciate the partnership with Amwins. It's special to us. My name is Rob Tees, and I have the distinct privilege of overseeing all of our growth in the state of Georgia for Anthem Blue Cross Blue Shield that expands into individual, small group, and large group. I've been with the firm for about 4 years. We're excited for the opportunity to discuss the state of Georgia and healthcare for Georgians.
Well, we're certainly happy to have you here today and really do appreciate the partnership. You know, the word partnership is a little bit overused, I think, in business today, but without a doubt, that's what we're all about, you know, partnership and how to help you guys grow and us grow together. And we're really looking forward to chatting with you today.
Likewise.
Tell us a little bit about Anthem's mission here in Georgia. You know, what is Anthem Blue Cross and Blue Shield? What's your mission statement? What's your market presence all about? Where are you looking to go here in 2025?
Certainly. Our fundamental promise in the market is to improve the health of humanity, something we take extremely seriously. We've been in the state for 87 years. We also are proud to serve all Georgians, whether that's through the individual products, small group products, Medicare, Medicaid, and extends into the large group products. We value our partnerships in the marketplace, as you mentioned earlier, not just in the broker and advisory space, but also in the care providers and health systems. We have a team of 5,500 people in the state, so we like to say Georgians serving Georgians, and we're very proud of that legacy. Our goal is to fundamentally bring new products into the market, new funding types, and to help employers with their budgetability of their health care costs.
Kind of leads me into thinking about product right out of the gate. Now, I know you guys are introducing your Anthem Balance Funded product in the marketplace in the 2 to 50 space. I think that's pretty exciting news, and it's welcome news, particularly for brokers and clients in that small employer space. You know, tell us a little bit about what that looks like for you.
I'll be glad to tell you a little bit about it. And actually, it's not the first time we've had a level funding, which we call ABF, Anthem Balance Funding, in small group. We had that product in small group before we rolled out our MEWAs, which were very impactful in the state. We sunset that product, focused on our MEWA, and then from market demand, we're bringing it back as an option. You know, we're not going to sunset the MEWA, but we're offering this in addition to the MEWA for a certain subset of the market. So we're only offering it in the 20 to 50 space, just because that we've had a big demand from brokers wanting reporting and just another option to offer their clients.
How has the ABF product worked in the larger group space for you folks over time, and how would you anticipate that resulting or looking like in the future when ABF cases begin to renew in the 2 to 50 space?
In our business where we relaunched Anthem Balance Funding or level funding for us or for the marketplace about 1.5 years ago, we've seen phenomenal growth, close to 40% in terms of membership growth. And the main reason is Georgians have a mature taste, if you will, for level funding. I think the community in the healthcare space really understands it, and they also recognize the width and depth of the Anthem network, and they can participate in claim savings utilizing our deep discounts. So there's a better opportunity for Anthem clients who level fund to have a surplus at the end of the year. Jeannie mentioned reporting, and that's a good feature that we've actually improved our reporting tools so employers and their advisors can have immediate access to claim data to help them manage their costs.
Folks in the small business space aren't used to seeing that data, brokers and clients. And so, over time, I think all the wellness that's been prevalent in the marketplace, those wellness provisions that we've all talked about, I actually think become way more meaningful now when we're talking in that level funded space, right? Where a broker or a client can actually identify places to help save them money as an employer and a plan participant rather than just saving a carrier money.
For sure, because they can see the return on that investment. And the investment around wellness can start with simple education for their employees and the loved ones they cover on the plan around choice of provider, using virtual health, avoiding unnecessary emergency room care, being better students around pharmacy selection and prescription selection, and ultimately designing a wellness program that fits that culture so that the return on investment is meaningful to that culture. A lot of people in wellness just rush to something that doesn't fit the population. It could start very small and then you scale up. But ultimately you can curve the medical trend and have better year-over-year, more predictable increases.
So super interesting talking about the reintroduction of ABF, Anthem Balanced Funding in the 20 to 50 space. But it's also well known here in Georgia that Anthem offers a lot of different products in the small business space. Tell us a little bit about your other offerings.
Yeah, so in 2019, we got approval in Georgia with the DOI here to offer a MEWA plan, which is fully backed by Anthem. So it's a viable product. Agents, groups felt safe enrolling into this MEWA product. Very simple product. Right now we have 45,000 members in our Chamber Smart product, which we have great partnerships with the Georgia Chamber of Commerce in the Smart MEWA plan. And then we also have a second MEWA, which we call the Farm MEWA. The partnership is with the Georgia Farm Bureau. Very different MEWAs. They attract different clients, different employer groups. The Georgia Farm Bureau attracts a lot of sole proprietors because it goes down to one life. The Smart Plan is going to attract businesses with 2 to 50 lives. But what we're seeing with the MEWA, which we're very competitive in, is that we're not capturing a lot of the business between the 20 to 50 market.
Hence the ABF.
Hence the ABF.
There we go.
So we rolled the ABF out, and I think that's unique to Anthem. And we have those options that we can offer, and groups can shop to see which is the best fit for them.
Diversification based on market segmentation.
Mm-hmm. Right.
That's really cool.
You mentioned the term or the word partnership earlier, and I truly believe it's critical in this juncture of healthcare that partnerships are paramount, they're proven, they're trusted. We have great partnerships with the Georgia Chamber of Commerce and the Georgia Farm Bureau, and that's the foundation of our small group offering. ABF kind of completes the opportunity in small group to be competitive based upon the need in the market. We are delivering our 4/1 renewals in about a month, and we're very proud that the average renewal is well below trend. So we're very pleased with the financial performance of the MEWA, and that means more affordability for Georgians.
An important concept all the way around. Every broker, every client thinks about their pricing and where that's going. You'd mentioned partnership. I think about brokers all the time, right? Brokers are our clients, brokers are your clients. As we think about brokers and reintroducing of ABF into the marketplace, the MEWA, your mid-market business at 51 plus, we know that you guys are looking to write that business as well. What are the programs or things that you're doing in 2025? Do you have incentive plans? Do you have things that will motivate a broker and a client to want to do business with Anthem Blue Cross?
Our best partners in the market are our brokers. And that's very important to us, and that's why we have this team of representatives that are, I call it boots on the ground. I mean, they are out there, they are talking to these brokers, they are building relationships, and I do think it makes a difference when we look at our net growth, because a broker is going to place business with a carrier that they know is going to support them when they need it.
That's right. And I think about that with, our M1's Connect sales folks on the ground, teaming up with your team. The partnership that we show together in the marketplace is really exciting, and I think something that's going to move some good numbers for us here.
Right, and it starts with speed. The ability to onboard a new client quickly, accurately, present them with either digital or actual plastic ID cards is still extremely important, so they can have the security and confidence on day one that they can access benefits, and the ability to educate brokers and clients around some of the tools that will enable and empower their workforce to be healthier, also to be better consumers of healthcare. And the best feature we have for that is our Sydney Health app. Our Sydney Health app is an award-winning app with incredible reviews in the App Store, a 4.8 app rating. And it's all the things that you'd want in a health app, from wellness, as we just talked about, but also accessing EOBs, to having the ability to chat with a healthcare clinician for real-time symptom checkers, find the nearest provider, or doctor or hospital that's affordable, but also accessible in the member's area, the ability to send your kids ID cards, because I know that I lose mine, but the ability for our kids to have an ID card in the wallet is extremely important. It's very AI empowered, so it really has some opportunities to track some of your data, reminding you to fill a prescription,
Right.
something that basic, but also really understand if you need a follow-up care from your recent visit, and if you're overdue to see a care provider that you may have missed an appointment. So there's a lot of connectivity within that app, and we have incredible adoption in Georgia. Nearly 70% of our members utilize the Sydney Health app, and we want to get that to 100%.
That is amazing. That's a huge number. I think that two things right there, Rob. One is, technology. It's here to stay, and the
Yes, it is.
better it gets, the better it's going to be for all of us. Then the one thing that I heard you say that I think is sometimes lacking in our marketplace in the benefits space is a sense of urgency, and you alluded to it in the very beginning of that segment where you said speed to market, get the case in, get the case out, get it approved. That's meaningful, and that's a really important thing. And I know Amwins Connect, our teams work with a sense of urgency, and it's so refreshing to find that our carrier partners are thinking the same way.
Agreed. You have an amazing team, and we look forward to that partnership for sure. And it's a big spend. We recognize it's a big spend for employers and employees. It was 30 years ago when I started. It continues to be. Our goal is to optimize that spend and to create an environment where year-over-year healthcare inflation is more adequate and affordable for the common American or for the common business owner.
One thing I'd like to add about that Sydney app is that members can actually have live virtual visits with doctors through that app. I know I'm speaking for me, but I think I'm also speaking for Rob, that it becomes personal for us to make sure that our members are taken good care of. We get calls, that become urgent. It's just a personal situation with us where we want our members to be happy, and if they're not happy, then we're not happy.
And I will tell you that we talk about that at Amwins Connect, right? It's meaningful when someone's waiting for their ID card because they need to get a prescription filled, and we take that very seriously as well. So again, perfect alignment.
You're absolutely right.
So you mentioned on the Sydney app the ability to look up a provider, and that's really fast and easy to do. And it brings to mind, the network discussion, right? Substantial networks here in Georgia, and you dovetail that with the Blue Cross and Blue Shield national presence. Talk a little bit more about network and the impact to the marketplace and your clients and our
Sure.
mutual clients.
Yeah, I mean, that's probably our strongest asset, quite honestly. Healthcare, of course, is incredibly local. It's so important to have a local network of doctors and hospitals. In the state of Georgia, we have a physician in every zip code in the state. We have a robust network from each border, east, west, north, and south. Partnerships with health systems is paramount to our success. But it goes beyond Georgia, as we know. And Anthem, we are one of 14 states within a leading division of Elevance Health. And we have access to the National Blue Card, I think, as you know, Tim. And the National Blue Card also has a doctor in every zip code across the United States, and it's providing for generations some of the best access and certainly the best discounted position. But more than that, as healthcare continues to evolve, and the 2 or 3 things that we're working on now is our value-based care initiatives, that is partnering in a very collaborative way with doctors and hospitals around outcomes, and that is incentive-based programs, but also addressing areas for greater access, greater follow-up care, a higher commitment to outcomes. We have a program called our High Performing Network, which yields approximately 15 to 20% differential to a premium price that an employer would pay. It's an exclusive network of doctors. Not every doctor is in it, not every hospital is in it. It is becoming a very attractive option as a dual option for employers of all sizes to select. Again, around the theme of continuing to educate patients and consumers to access care more thoroughly and to help them understand what's best for their family. So we are finding tremendous success around what we call HPN, or high performing networks, which cover about 2/3 of the country. All the major MSAs have a robust HPN network, including Georgia, with our partnerships with Emory and Northside and Children's Healthcare of Atlanta, as well as Grady, and hundreds and thousands of independent physicians.
We also use that HPN in our product portfolio. We mirror it with our open access plans. If you have a $1,000 deductible plan, 80% on open access POS, we're going to mirror that on the HPN. So an employer can actually put in both options and let their employees choose which network they want to go with. So it gives a substantial savings to that employee who has access to that HPN network.
Well, there you go. And savings are a good thing. Is every day when an employer is looking at their healthcare expense, it's typically the second most costly item on their P&L.
Especially in small group.
Especially in small group.
And if I could just inject one other thing that is both personal and extremely important to healthcare, and that's the accessibility to mental health providers. And one of the things I'm most proud that what Anthem has done over the last several years is to partner and widen our network of behavioral therapists, both online as well as traditional brick and mortar buildings for people to go in and see professionals. And I believe that's important from adolescence all the way through senior adult living.
That trend is really important in the marketplace these days. And you talk about the national network as business becomes more and more decentralized, right? Where not everybody goes to the office, or an employer in Georgia has 10 employees in the metro Atlanta area and another dozen employees in 10 other states.
Correct.
So the network viability.
It also connects back to your great question around wellness. A lot of our wellness platforms now look at things like stress and sleeping and anxiety, and really try to tackle those issues up front from a prevention standpoint, as well as offering a robust network. So it's very important in this post-COVID chaotic world that we live in, that we have to recognize that there are some invisible conditions out there, and we have to make sure we're doing a good job, a much better job than we've done, frankly, as an industry.
Good info. Thank you very much. There's so many different things that we can talk about in such a short time frame. One of the things that I think our broker community would like to know about is our partnership with Amwins and Anthem. What are the brokers looking for? What is it that you guys would like to tell the brokerage community as we launch forward in 2025?
What I would like to say is that we're open for business here. We're stable. We've been here for 87 years. But I would like the brokers to know that our relationship with them is extremely important. They are pretty much our lifeline here with the employer groups members, and with our balanced funding plan is we want to be flexible. We want to help them transition their existing level funded plans to Anthem by offering transitional credits, flexibility with stop loss, flexibility with surplus percentages, and just know that we're here for them.
So when we think about the good that we all do every day, or strive to do every single day, it brings to mind the customers that we have mutually. They're not just MIWA customers in the small business space. They're not just ABF customers in the 20 to 50 space. There are other markets that Anthem Blue Cross and Blue Shield writes business in, and let's talk real briefly about what those other markets look like and your appetite to be in those other markets.
Sure. We're very proud with our relationships with municipalities, starting with the state government, the college and university system of Georgia. We have major municipalities like the city of Atlanta and Fulton County and dozens of others. We have over 400 municipals in the state of Georgia in our client portfolio. We also have a significant presence in the national account world, the big employers that have tens of thousands of employees across the country. We're fulfilling our brand promise in that segment. I mentioned earlier a little bit about the individual segment as well, which is a growing piece of our business. in Georgia, as well as in our other 14 Anthem states. And finally, the work we're doing in the Medicare and Medicaid space to sort of be the catcher's mitt, if you will. Wherever you are in your healthcare journey, we have a product or solution for you. And we're very excited about that. You could go down your street and you could work for a national employer based in New York, but be part of Anthem Blue Cross Blue Shield of Georgia. Person across the street could be a retired person who's on one of our Medicare programs. The next person could own a small business and utilize one of our MEWA programs or our level funded program. So we want to be the all-encompassing solution.
You mentioned the small business space again, and I think about success of business. Talk about the transition that an employer might make if they are in the Affordable Care Act world at 45 employees or 48 employees, and they have a really good 2024, and all of a sudden they've got 60 or 65 employees. We call that the mid-market space, right? 50 to say 99. What's your appetite in that space? I think that's the only space we haven't really talked about. And what does that look like for you guys?
It's been a growth engine for us. I mean, Georgia is so blessed economically, thanks to our leadership at the state level. More companies are being incorporated in Georgia. More people are moving to the south, and Georgia leads the way in terms of population shifts in the country. We're here to serve those new people. I moved to Atlanta 25 years ago, so I guess I'm a native by that measure. However, we recognize that we're having an incredible economic growth spurt. And a lot of companies do shift from, like you said, maybe they start. Some of our bigger companies that are now employ thousands of people started with 8 employees.
Started out in someone's garage, right?
And I'm thinking of them right now in my mind. And that's a great American success story. And we've been there as they have evolved, because an 8-life employer might need something different than a 48-life, than a 98-life, and certainly a 3,000-life employer. But to answer your question, 51 to 99 is a segment that we manage on our own. We have, of course, the Sydney app is available for all members. We start there, but we also have level funded products, fully insured products. We have a separate sales team for that segment. That's been experiencing some very good growth numbers for us, and I think we expect it to continue. We don't want to just pigeonhole an employer as your small group and your mid-market. You're an employer to us, and your needs matter, and we want to make sure that we're bringing the best value to your benefit dollar, regardless of your size.
What about the specialty side? I mean, I know there's a large part of your Anthem portfolio that lies in the specialty world, and so talk to us a little bit about that.
With specialty, we look at it as a whole health connection. So, with the dental exam, there are a lot of diseases that can be picked up through a dental exam. There's a lot of diseases that can be picked up in a vision exam. So we like to couple those together with the medical and integrate all of that. So if you go for your dental visit, then it's going to be picked up on the medical side, and we're going to be able to do outreach to the member. They can accept the assistance or not, but we may say, hey, in one of your exams, it was picked up that you may be at risk for high blood pressure. Maybe you need to see a primary care doctor. So we do a lot of whole health work. But in addition to that, if an employer purchases our specialty, our dental, our vision, along with the medical, then what we're going to do is we're going to discount the medical products and say, hey, just because you're doing this is great for your employer's whole health. We're going to shave points off of the medical premium to help you finance dental and vision products that you place with Anthem.
And clients and brokers love the word discount.
That's right.
Right.
Yeah.
I'm so glad you brought up the dental and vision conversation. I think one thing I'd also like to leave you with, Tim, is our work in the prescription drug space with our partner, Carelon RX. That's embedded in all of the Anthem programs, and that addresses affordability in the prescription drug space through dispensing through mail, through a vast retail network of pharmacies, very innovative specialty programs around cost relief mechanisms, a program for generics called InsureRx, which guarantees the cheapest generic will be dispensed at the retail pharmacy, and just a host of other programs to help members guide, understand, and be compliant with their medications. It's fundamentally important. We know the exploding costs of pharmacy, prescription drugs, They do great things for us. They help us live longer. They help us be our best self, but they're not cheap. Our focus is on finding the right prescriptions for the individual, make them compliant, make our purchasing costs economical, provide the best rebate value for employers who participate in a rebate share, which is typically through self-funded programs.
Well, I think it's really cool that you talk about all of those things that make the plan work, and more than anything else, how they get down to the patient level. You're getting the right prescription to your patient, to your client at the right time, at the right price.
Absolutely correct. It's vital.
Jeannie, Rob, I can't thank you enough for joining us today. Coffee with Carriers is an important part of what we do and how we get our messaging out to the marketplace. So thank you all very, very much for the partnership. And we really look forward to putting up some big numbers with you guys in the future. And everyone, thank you so much for joining us for another episode of Coffee with Carriers. Great to have you on board.